Trigger points are discrete focal hyperirritable spots located in the taut band of a skeletal muscle. Okay, what is discrete? Do anyone know? Okay, discrete is means individual. Okay, discrete means individual. Focal, it is a center. Okay, hyper irritable spots is like it just give irritability, which is located in a taut band of a skeletal muscle. What is a taut band? Okay, it is a taut band of a skeletal muscle. Taut band is a tension band. Okay, tension band in a skeletal muscle. What are the different types of muscles? Can be little audible the person which is nearby. Can you answer, or a mic can be given to the person who is nearby? A taut band of a skeletal muscles. Okay, the spots are painful on the compression. When you touch the spot, patient comes. So on a patient perspective, when the patient comes, it is like they say the pain. Okay, so the spots, if you touch, they will on its compression, it produces a referred pain. Okay, that is the difference actually between a tender point and a trigger point. Okay, refer point, when you touch the exact trigger point, that gives a radiation. As if you can see, right, I have made a mark which is of yellow in color, and it gives a refer point to all the other parts. Fine, and it gives a referred tenderness. So it is like it is not specific to one area, where it is specific to all other areas also. So motor dysfunction, when a trigger point is there, they doesn't complain only of the pain. On an worst case, even the patient or the person complain of the restriction of a motion. An autonomic phenomena of a compression. Autonomic phenomena is a sensation. Okay, those sensation we'll speak on later in the clinical features. So on compression, it trigger the referred pain, it trigger the tenderness, and normally the trigger point is gives a restriction of the movement, and then with the autonomic phenomena. So now it is like to go a mild basic with the skeletal muscles. Okay, there are three different types of muscles, right? Three different muscles are skeletal muscles, smooth muscles, and the cardiac muscle. Okay. Now I just like I have, as I asked the question, it is like a three significant muscle tissue in the human body. And the skeletal muscles, attaches to the, it attaches what to the what? What? Bone to the bone by the tendon. Right, you're right. So it attaches to the bone by the tendon. The skeletal muscles are crossed with a regular pattern of fine. Two lines will be there. What are the two different fine lines? The red line and the white line. Okay. And it gives the muscle a distinctive striated appearance. So it is called as, what is the other name of a skeletal muscle? Striated muscle. Yeah. Okay, the next is the skeletal muscle. Okay, this mild basics we know. Okay, as we saw that it attaches the muscle to the bone by a tendon. Okay, so there is many muscle fibers in our body. Fine. The muscle fibers are covered by the covering called endomysium. Okay. And there is like different, all the group of muscle fibers are enclosed, and those are termed as fascicle, and those fascicles are wrapped, connected to another fiber layer called perimysium. Okay, and all this endomysium and perimysium is covered by another covering called epimysium. Fine. And that is the muscle bundle. This is a cross section of a muscle fiber, right? A muscle bulk. Are you clear with this? Yeah. So this is what I have made it. And what is a sarcomere? Yeah, that is the question about, again, the structural and the functional unit of the muscle fiber arranged between two Z lines. Yeah, you're right. Is a structural subunit arranged in a repeated pattern along the side of the cells. Okay, it is an Z line. So what is an Z line? There are different types of proteins which is present in the Z line. Okay, chitin and alpha actinin are present, express structural proteins of the Z line, and the Z line proteins creates a special network of interactions that acts as scaffold and connects the thin filaments from an adjacent sarcomere. What is a scaffold? What is this Z line does? You know what is a scaffold? In the building constructions they does, right? They connect the different types of pipes for them to build the construction, right? So here the Z line acts as a scaffold which connects the muscle fiber from the one tendon to the another. Fine. Okay, the classification of the trigger points. As if, what are the classifications you know? So it is based on the characteristic and based on the location, the trigger points are classified into many varieties. Okay, and here we are today gonna see about based on the characteristic and based on the location. Based on the characteristic, it is classified into active trigger point and the latent trigger point. And based on the location of the trigger points, it is classified into primary and secondary or the satellite trigger points. Fine. And the active trigger point and the latent trigger point. Pain at rest, when according to the patient or like as a person coming, when they are telling I'm having the pain at rest itself, it means it is an active trigger point. Okay, it is a tenderness to the palpation with referred pain pattern which is similar to the patient's pain pattern. Okay, when we palpate, the person says, okay. So for example, even on a trapezius, upper trapezius muscle, when it's onto the bulk area, the patient or the person say that the pain is there near to the ears. Sometimes they even say it is restricting the shoulder points. Okay, it will be as if it is connected to the clinical features. Okay, a latent trigger point does not cause a spontaneous pain. Okay, everyone have a latent trigger point. Can everyone touch your brachioradialis muscle? When you give a deep pressure, are you feeling the pain? Yeah, this is the active, that is a latent trigger point. When we give a deeper pressure, we get it. Okay, it may restrict the movement and cause the muscle weakness. But what is the thing is, the latent trigger point will be always present with everyone. It is not that whether the person is an old age people or a younger generation or all the clinical features, even from a kid to the elderly people, the latent trigger point is present. But it get an aggravating factor, triggering factor for it to transfer into an active trigger point. Fine. Okay, and the primary trigger point, as if like we say, where first example we had it on the trapezius muscle, right? So now we think like the brachioradialis, we know the condition like tennis elbow. Yeah, when a repetitive movement on the primer area, prime area, there will be a trigger point. Okay, whereas the secondary trigger point, which is otherwise called a satellite trigger point, will be into the connected area of the primary trigger point. Okay, so for example, yeah, to say a person with a trigger point, primary trigger point on the gluteus medius muscle or a maximus muscle will have the trigger points to their hamstrings and to the lower connective area. And the secondary trigger point, if you treat the primary trigger point, then you don't even want to treat the secondary trigger point. It itself diminishes when we treat the primary trigger point. Are you clear? Yeah. What is active trigger point? Yeah. What is a later trigger point? Yeah. What is a primary trigger point? Yeah. Secondary trigger point is otherwise called as satellite trigger point. Clear. So what are the causes? Okay. Causes are of many varieties. Fine. So even lack of sleep will lead to a trigger point formation. Okay. And a poor posture when they have a continuous strain onto the muscles. Overloading of the muscle leads to the trigger point. Okay. Obesity causes trigger points. Why the obesity causes trigger points? The muscles are bulked, right? The muscles are compressed through the fat deposition. Yeah. So that is also a reason for the trigger point. and injury or a trauma. So on an different occasions, say lack of sleep or poor posture, gradually it leads to a trigger point. Whereas an injury or trauma leads to a immediate trigger point. Immediately the trigger point start developing because of the confusion on the muscle. Fine. Dehydration leads to a trigger point. Do anyone know it? The dehydration, when the water intake are less and when the protein or like, so muscle is made up of protein components, right? So when the water intake is less, the muscle loses its property, and where there they shrink and it leads to formation of a trigger point. Fine. And smoking leads to a trigger point, whereas lack of exercise or the movements leads to a trigger point. Fine. Other than this, what are the causes can be, which is known to us? That's why I have not made it here. The repetitive movements leads to a trigger point. Okay. And next, the musculoskeletal issues leads to trigger point. Okay. Can you name the musculoskeletal conditions which leads to trigger point? Okay. We know osteoarthritis, right? So osteoarthritis is the changes in the structure of the bony component. Okay, that is onto the articular spaces, whereas even in the osteoarthritis we have the trigger points. Okay, the pain is also a reason of trigger points. Okay, it is not only because since if you started handling patient, when the person comes with an osteoarthritic condition, there will be clinical changes in their joint, okay, articular places. Whereas if you treat the trigger points, the complaint will be totally gone, and you have to just focus on the strengthening of the people. Okay, clinical features. So what are the basic clinical features we know? It's a pain. The pain will be a dull aching pain. Fine. And next will be the tenderness. Okay. Tenderness means what? What is pain? What is tenderness? What is pain and what is tenderness? Pain is an unpleasant sensation is all throughout the time. Okay. Whereas tenderness is when we touch. When we touch, if the pain is elevated, that is a tenderness. Fine. Okay, a palpable knot will be there. Okay, and even in a worsen cases, the palpable knots or even visible knots. Okay, if in a condition like scoliosis or of an overstrained person, it will be a palpable, it will be a visible knot. Okay, the hallmark of the trigger point is the knot. Even when a patient comes, they themselves will give you a word in your history collection telling that I have lumps in my muscles. Fine. And the next is the stiffness. The trigger points leads to restriction of the movements. Okay, because the muscle is contracted, the sarcomere structure is constrained. Okay, the actin and the myosin filament will not be able to come back to its original places, whereas it is contracted. So the contracted muscle fibers leads to stiffness of the joints, whereas you you have a restriction in the movement. So you will have a tingling sensation. Okay, when you touch the pain, you will have a doubt whether the patient is telling about a nerve problem or a trigger problem. But though if you go with a sciatica person, okay, sciatica is a nerve involvement, right? So the clinical features of the sciatica will be more or less same equal to your piriformis syndrome. Fine. So when you treat a piriformis muscle along with the other satellite trigger points, what happens is the pain is get subsided and the patient get relief. Okay, so it was more or less clinical features of a neural injury. Sorry, not injury, neural involvement. So warmth will be pleasant. We know, right, in a clinical when the muscle is being affected, the warmth is also a major thing which we have to know. And localized weakness and fatigue. They say like, ma'am, I'm feeling like, the patient say, I'm feeling totally weak. I can't do anything. I'm feeling like this muscle don't have any energy. Whereas we think like whether any neural involvement is there, or we think like is there any neural injury? Okay, so something even related to a mono parastasis. Okay, the other is the delayed muscle relaxation. So first, if you go like when patient or the person come when you're treating, you're going with stretching. Okay, they don't even feel the stretch effect. But normally, if he does stretching, what does you feel? You feel a, what does the patient say when you do the stretching? They say they are relaxed, right? The range should be increased and it will be relaxed. Okay, but here if you don't treat a trigger point, then the patient will not say. Even you do 10 sessions with ultrasound stretching and even with other equipments like laser, they will not say any relief. Fine. And jump sign, this is the predominant, as I told, like the top band, the knot is the hallmark, the jump sign is the main thing. You know what is a jump sign? You touch the patient on the trigger point, the patient will start jumping. Okay, if they are in the lying, all their body gets shook. Fine, that is the jump sign. And a referred pain. So when you touch the active trigger point, there will be a referred pain. No, local twitch response. This actually mainly happens with the latent trigger point. Okay, when there is a latent trigger point being activated, the local twitch response you can see visibly on the muscle fibers. Redness. So when we touch the trigger point onto the treatment later, we feel the redness. Initially, it may not be more, but there will be a erythema, the redness onto a minor level. So investigations. Okay, the main investigation will be like the gold standard method of the trigger point manual. It will be the gold standard. Okay, we can see what are the gold standard points to be followed. Palpation of a taut band. When we touch, we feel the taut band on the muscle. That is the main thing. Identification of acutely tender nodule in the taut band. So we find palpate the tense muscle, then the dense muscle will have a tender nodule, then that reproduces the patient symptomatic pain with the sustained pressure. This will say, this is the pain I feel. This is what I'm getting. Okay. So this is the gold standard method to do investigation. And the other thing is like now recently high definition ultrasounds are being there. So where we can find the trigger points. There will be an echoic showing the sac of the trigger points. And vibration sonoelastography. Okay, this is on to the later stages, but the pure thing for the investigation is the trigger point manual technique. So management. Okay, so if it is like trigger point treatment consists of trigger point stimulation which leads to trigger point abolishment. Okay, so what we does is here on the trigger point, we stimulate the trigger point again. Okay, that is how the treatment of the trigger point works. Fine. Is it audible? Yeah. So unless thereby the trigger points are abolished. Fine. And the next will be if many trigger points exist, we have to be treat and abolish all. Okay, so the trigger points will be like many, and we have to treat every trigger point. It is like if it will be a primary and secondary, then it is not the problem. But you think if the patient complains of a neck pain, okay, and you are treating a trigger point on the trapezius muscle, which means specific to upper trapezius muscle. But if you are not treating the lower trapezius and the middle trapezius, then the pain will not get subsided. Every muscles are interconnected, right? And when even a neck pain, when the trapezius strain is there, there will be a conjoint activity of a biceps muscle or a deltoid muscle. So it is like all the trigger points in every muscle has to be treated. So the methods is of two methods. Can you, as anyone know, what are the different methods? The different methods are the invasive methods and the non-invasive methods. What is a non-invasive? What is invasive? It triggers the it again produces the pain. Okay, it will be a pain producing treatment, where non-invasive is like that don't hurt. Okay, and a non-invasive methods are cryotherapy. We will advise them to do the cryotherapy at home, because the patient will come for the treatment only for 1 hour. Okay, but if you do trigger points and then again the pain gets started, then there you have to advise them to do the cryo. Okay, cryotherapy is the ice pack. Okay, the cooling therapy which we do, cold therapy is called as cryotherapy. Then we can give pens when people think it is like trigger points. When we get more different updated treatments, then it is not meaning that we are not supposed to do the traditional methods. We can do even the traditional methods. Okay, if an old age people is coming, then if you learn dry needling, then if you learn the cupping therapy, then if you learn the soft tissue mobilization techniques, MFR and everything, then it is not that you have to do only the um, those techniques. Okay, it is like you can even handle the situation with the hence ultrasound, stretching. The patient comforts means a lot. Okay, so what is tense? Okay, so tense is a good modality where the patient didn't get any complaints or any aggravation. Okay, so we can use TENS as an adjunctive therapy. Ultrasound can be given. So ultrasound therapy, how you does the ultrasound therapy? So the ultrasound therapy, we have very many different methods of application, right? Transverse method, spiral method, figure of eight method, yeah. And how the speed of the ultrasound should be given to the patient. What is the frequency? So the method of application of the technique is most important. Okay, as you know, like ultrasound, we should apply the gel. We have to check it before each and every time. It has to be followed. Okay, it is not that when you are doing your clinical training or only internship you are supposed to do. You are supposed to do all the time. You should follow all the principles which you are learning. Okay, I have made all as a one single term because it is very big vast techniques, right? So it is like application of the gel has to be applied. Then when you are on the post period of the treatment, you are not supposed to be in not in you are supposed to be in contact with the patient skin. Fine? Yeah. Okay. And with the variation and like with ultrasound, that is like placebo effect. If you're giving for 12 minutes, 15 minutes, we even have the variations in the ultrasounds, right? Constant mode, 1:1 ratio, 1:4 ratio, 2:4 ratio. Yeah, but always go on to the when you are giving a trigger point therapy, trigger point treatment, then there you are supposed to give a constant ultrasound therapy. Fine, with a minimum minutes of 8 or 10. Fine. Okay. Stretching. What is stretching? With the passive stretching, active stretching, ballistic stretching, PNF is one of a stretching technique. Okay, you can do the muscle which is involved and you can do accordingly. Fine. And postural correction, though you give the advanced techniques of the treatment like dry needling, IASTM, and if the patient is not correcting, gonna correct the posture, or if you're not gonna give an ergonomic advice, then that is not gonna help. Okay, then the patient will come, ma'am, when you does the treatment it is fine, but when after again to work for 3 to 4 months, then the patient comes back. So posture plays a very main role. Okay, a big role in the trigger points. Fine. And taping onto an elevating factor. Fine. When the patient comes, you can apply the taping on like muscle. That even in the tapings we have different techniques like muscle technique, correction techniques. Okay, so it depends on the anatomical structures of the muscle and like what the muscle has gone for weekend or it is being overacted. Everything depends on the treatment of the muscle. Fine. And laser therapy is also used as an non-invasive invasive method for the trigger point. Fine. So the invasive methods. The invasive methods are trigger point therapy, injection therapy, which we are not doing. The clinicians, the physicians will do. instrument assisted soft tissue mobilization, wet cupping, position release therapy, myofascial release therapy, fine, along with the dry needling. Fine. The injection therapy is of many things. Okay, a dry needling is also comes in some injection therapy, whereas we are not gonna inject any liquid molecule. Fine. Whereas it is a dry needle being applied inside. Okay. So trigger point therapy. Trigger point therapy is the technique which we use. We give palpation on the trigger point. Then what we does is we give a maximum pressure until they say the pain level is 0. Okay, so we are gonna give a constant pressure on the trigger points. Fine. Yeah. Yes. So you're gonna give the constant pressure on the trigger points. Then the patient will say, "No, I am feeling numb." Then you are relieving. Okay. The pressure has to be constant. It should not be relieved. If this is the trigger point area, then if the patient you are gonna apply, it should be the same constant pressure all throughout the time until the person say it is relieved. Fine. That is a trigger point therapy. And injection therapy, have you seen the dry needlings? A dry needling. So the packs comes like this for the dry needling, and it is a pack like this. Okay. So it is, we always use a sterile thing. Okay, and it is a disposable one. Fine. Okay, and when it is, we have five needles here. Okay. So when you open, it is a guide tube there. Okay, tube is there, and we have a guard here which has to be removed. Fine, and this is a needle. Can you see? Is it visible? Yeah. So this is an area which will not get injected inside the body, and the lean area will be getting inserted into the muscle area, right? But you should be so conscious enough when you are injecting into the patient, fine? Because there will be blood vessels, there will be nerve, okay, and the muscle taut bands are there, fine. So bone area is there. So we should not give any infection to the patient. The treatment what we does should not be an provocative for any of their infections, right? Okay. So for that, the basics of anatomy and everything is must require. Yeah. You know all the bony margins. Yeah. So it is like we should be more conscious enough in when we are does it. So it is like, I'll say, with the sensation of the trigger points, it will be like when you are palpating on a trigger point, fine, it will be like a heart, where it is like when an n number of, for example, if we are inserting into a soil, what the feel will be. That is the feeling a therapist is gonna feel when you are gonna inject inside the patient, fine. But whereas if you think, if you are not gonna inject inside a muscle, it will be like a bony when you touch a bone. So you are not supposed to go deeper enough onto the bony prominence area, right? Always on a safer side, you have to use the needling. Okay. So when you are injecting in on a nerve, okay, it is not that we are doing on a naked eye, right? So it is not visible. We are not gonna connect it with an ultrasound, and we are gonna do the needling techniques. It is like we are gonna practice on a bone. So it is like when you are inserting, the person say, "I am feeling numbness or a tingling sensation," then you are supposed to stop immediately. Fine. You have to just make it out. You should not say, "No, I'm gonna do I5 on the trigger point." It has to be not told. It has not to be done. Fine. And when you are injecting onto the blood vessels, you feel it like you are injecting the needle into the bone. Yeah. Okay. This is the feeling what you get. So it is like you can do this trigger point using the dry needling. Fine. And next comes the injected through the liquid, and that don't we don't do through the injecting therapy. And for an the techniques how you has to use the dry needling is like you should be always sanitize. Okay, sanitize your hand. You are supposed to use the glove, fine, and then the patient area should be sterilized. Then you are supposed to do the dry needling. Yeah, but when it comes to an IASTM, it is a different. Okay, the skin preparation of the muscle itself is totally different. The sterilization using the glove, you are not supposed to use the make the non-sterile area inside the muscle, and when you out of the patient body, then you are not supposed to use it. Whereas in an IASTM, the skin preparation is totally different. You are gonna lubricate the muscle. Fine, we'll be using the moisturizers and applying it on the skin. Okay, and there are different shapes of instruments which are being used for the soft tissue mobilizations. Okay, and it is like pointer for each and different area, and I'll tell the name of each and everything. First you can have the look of it, and this is what we use onto the um, wider area. Okay, so it is like when you are focusing onto the thigh muscles and onto the back muscles, then you are gonna supposed to use it, but you are not supposed to give a complete pressure. Fine, you are gonna give a mild pressure over the muscles. Okay, and this is an instrument we'll be using for scanning the muscles to find the initial trigger points. Okay, so it is like we find it on the muscle. Yeah, then palpate the trigger point, and then along the course of a muscle you are supposed to use the instruments. Yeah, and when a person is having any blood disorders or cardiac issues, then you are not supposed to use this on the trigger points. But the cupping therapy will not be used on a trigger points, but whereas it works on the acupuncture points. We have different so acupuncture points, it works on the Chinese methods. Okay, it works on the meridians of the body. Okay, we have different meridian points. Fine, it is related to each and every organs. Okay, so they have a different theory. Okay, and there tell that the positivity and the negativity of the energy transfer is there working on it. Okay, so here we use the vacuum cup. Okay, we have the gun. Okay, so here we place it on the muscle of the patient, and there we keep the cup and inject. Okay, the vacuum space is created. Fine, the vacuum space is created, and there the muscle holds. The trigger point is being hold. Okay, and the trigger point is being hold, and like we have to make it stay for a while. There will be a redness being formed. Yeah, and that redness, it is of many different scales. Okay, so if a person is having anemia, then you're not supposed to use it. We tell it as keloids. Yeah, okay, and there is different ranges of the erythema being formed. Okay, so it is like we use the n number. It is not like only onto the one particular area. If you think like the problem is onto the quadratus lumborum muscles, then we does it on quadratus lumborum muscle. Onto the upper area, you know the lower cross syndromes and upper cross syndromes, right? So if it is onto the QL muscle, then the lower cross areas, everything has to be covered. Yes, then for the upper cross leg, then from the neck, it has to be on the center point. Okay, the center point has to be made. Then all along the muscle fibers till the end of the radiating point, you have to place the cupping. Okay, there are different sizes of cupping being used, cups being used. Okay, over the bony prominence, you can use smaller cups where it is onto the bigger, onto the neck areas, onto the sternocleidomastoid muscles, scalene muscles. You can use these smaller cups. Fine. So the vacuum is being created on the. I'm going to show you I'm just placing onto the muscle, fine, the cup for your demonstration, fine. And the cup is being inserted, and we are creating the vacuum, and the muscles hold the cup. It gets fixed like this. Can you see the muscle is being inserted inside the cup? Yeah. So this is how this cupping therapy works. And in cupping, we have the wet cupping, and then for relaxation, releasing, you have to release it. Okay. And in cupping, we have wet cupping, dry cupping. So wet cupping, we use the minute surgical blades, okay, along the muscle trigger points or the meridian points. Then it is being a cut have to be done. Okay, when you are being a certified person, then you can do it. Okay, so the cuts has to be done onto the point. Then the same again, a cup, the vacuum is being suction and being kept onto the overcut area. Yeah, there the blood is being oozed out along the cutted area, right? And it will get collected into the cup. So those we say it is not the blood, whereas it is the toxins in the blood. Okay, so it is like then removed, then the patient completely get recovered out of it. Okay, then we have the fire cupping. Fire cupping, in that fire cupping, they does like with the bamboos and even with the glass. This is not. This is meant for the vacuum thing, and there will be separate glass jars which will be present, glass cups which is being kept. The we have to make a top. Then the cotton will be inserted. Fire will be made. With the fire, we have to rub it along the inner area of the cup. Okay, and along the inner area of the cup, then the vacuum is created. Then it has to be like, placed on the muscle fibers of the patient. Okay, so that is how the fire cupping works. Yeah, so it is like you have to do certifications on dry needling, then certifications on cupping, then the certifications on instruments such as soft tissue mobilization. The world is running so fast, fine. And there, if you are being just following onto the only traditional methods which is there, then it will not be a, you can't get succeed into the field of physio. Okay, it will, you should be always keeping updated. If not, you will be outdated. Okay, so these are very basics I have told you. There are many even therapies like blood constraint therapies on the trigger points. Okay, along with this is not that only these muscles, these can be used, but you can use all the techniques. Okay, the patient came with a scoliosis, and she has a degree of 15 degree. Okay, but there is a wonder happened, like when we, it is not a wonder, but it is an after effect of the treatment. When the cupping along with the needling of an IASM is being done, the patient get recovered within 10 days. The curvature of the scoliosis being converted to 5 degrees. Okay, so these are the techniques can do wonders in the field of physiotherapy. So I would always advise, and I would always suggest you people to keep updated with the techniques. Okay, go for many workshops, go for many seminars. Okay, make your basics so strong, which is being taught by the lecturers, professors in the college. Okay, the basics means a lot. Okay, if you don't know the muscle, the origin insertion, if you don't know the bony component, where the bony land markings are there, where the ligament is, where the tendon is, then we will end up in messing up the things. So for you to go and learn the advanced techniques, initially you have to make your basics so strong, right? Thank you.